Throughout the month of June, we shed light on the importance of prioritizing men's health and well-being. Joining us today in honor of Men's Health Month is emergency medicine physician for Trident Healthcare, Dr. Kenneth Perry. Dr. Perry, it's so nice for you to join us today.
No problem. Thank you for having me.
So I do have to ask you, what are the most important steps that a man can take to prioritize his health?
I think one of the things that you really need to have is a primary care doctor.
Okay.
Especially because there's so many different screenings, there's different recommendations on these screenings, and they change all the time. So it's always good to have a really good primary care doctor, and also to have a good relationship with a primary care doctor, so that way they can know what screenings you need and what things we need to do to increase your health.
Absolutely. And I read that most men in the Low Country don't have a primary care physician and don't go to the ER. Why do you think that is?
I think a lot of it has to do with both just life happening as well as stigma. You know, in the sense that for women who are in their 20s and 30s, they're equally as healthy, but they are a lot of the times needing an OB for their primary care for different reasons. So men during that time frame don't have that need to see a doctor. So they don't have a primary care, they don't have a reason for it, and then time just catches up, and then all of a sudden they end up realizing they're in their 40s without having a doctor.
And now a lot of issues that we see in the South specifically is high blood pressure, smoking. A primary care physician can catch these a little bit early on. What are some of the things that you see a lot common with as men age?
Sure. I think one of the major issues that we see is that anytime someone starts not being completely healthy with their food choices, and then all of a sudden that half a pack of cigarettes became a pack of cigarettes, they were pretty physically active, and then all of a sudden that ends up catching up with them. As we were joking here, this is a pound of extra fat. The more you carry that on your midsection, you increase your risk of diabetes and high blood pressure. And then we also know that with smoking that it will increase heart disease as well as lung cancer risks and things. So always good to get ahead of those. Now,
do you recommend that we go to the doctor once a year? Men go to the doctor annually?
I think it's a great place to start. We know that that's not necessarily always going to happen, but it's always good to start, especially with things like screening for skin cancers, as well as just making sure that you're having the right screenings for colon cancers and whether or not your family risk increases you for anything. Always good to make sure that you're having that yearly discussion.
And what is the real damage done by not going and seeing a doctor annually or as more often than not?
Sure. I think the damage that's done is just the fact that we're not catching things early enough. If you have these health issues, if we know that all of a sudden the last time you got on a scale was 10 years ago and you realize that every year it's 2 or 3 pounds extra, that's a lot that you have to then get off. And being older and maybe not as easily able to get to the gym and really not physically able to get those pounds off, now we're just behind the 8 ball and it becomes problematic.
So other than going to see a doctor, what are the other things, the other steps that men can take to increase their health?
Sure, I think physical activity, you know, one of the nice parts about living in the Low Country, obviously we're getting to the part of the year where it's harder, but getting outside and really being able to be physically active is a great opportunity. Really looking at those lifestyle choices, so, you know, maybe the fast food every day with a little bit too much alcohol as well as a pack of cigarettes a day. This is going to become a major issue, especially as men age into their 40s and 50s.
Absolutely. So where is a good place for men to start? Is there online sources, websites, places that they can go for resources?
There's obviously, you can certainly look at any of the screening options through either the CDC or, you know, governmental resources as well as local resources. We do have primary care doctors associated with Trident Health Center, so you know we certainly have that option. And the biggest thing is just getting that relationship with a primary care doctor to just figure out where you need to go.
Absolutely. Well, Dr. Perry, thank you so much, and it's Men's Health Month, so very timely time to talk about this important topic. Thank you for joining us today.
No problem. Thanks for having me.
Absolutely. We're back after this.